This video is designed as part of our teaching series about the open preperitoneal inguinal hernia repair. Today's video is about the day of surgery at the hospital. Most patients undergo open preperitoneal inguinal hernia repair either at the hospital or a surgical center. It's almost a 50-50 mix. The day of surgery can be really stressful for people. You may have never had surgery before. And so I want to walk you through what to expect that day. Most people get a ride to the surgical facility. Patients who are coming from long distances often spend the night, or we recommend you spend the night before surgery in a hotel nearby. You need to come to the facility between 1 and 1.5 hours prior to the surgical start time. And that's really critical because that's some of the most important part for you and a family member or somebody who comes with you to hear about the surgery a little bit, talk to the anesthesiologist, meet nursing staff. So it's important to bring somebody with you if you can. When you first get there, you'll be registered for the facility. You'll be brought up to a bay where there's a bed or a chair that you'll be able to sit in and talk to the operating room staff. You will meet a lot of people. Oftentimes you will meet a nurse that's specifically working in the pre-surgical area. They're there to make sure that you're safe. They're going to ask you a lot of repetitive questions that you may have already answered on the phone before surgery. They'll probably start an intravenous, usually in the arm, sometimes in the hand. And we'll give you a little bit of fluids. Typically, next would come the anesthesiologist or nurse anesthetist. They'll talk to you about your anesthesia. If you're having an open preperitoneal at Boston Hernia, usually the anesthesia of choice is a local anesthetic at the site of surgery with a sedative anesthesia through the intravenous. For patients who are on a thinner side, and by that I mean if you lay down flat on your bed and your stomach is pretty flat, you're going to be a candidate for local anesthesia with sedation. If you've got a little bit of rounded stomach when you lay down, then you're going to need a next level of anesthetic, which is called the Laryngeal Mask Airway. It's technically a form of general anesthesia, but most nurse anesthetists and anesthesiologists use a much lighter dosing of the anesthetic gas, or often even avoid it altogether and just use a propofol, which is the sedative anesthesia. You're still breathing on your own. We're just helping you by keeping the tongue out of the way. This is super common in people who snore or have sleep apnea. It's a very safe and gentle anesthetic, and a wake-up is almost identical to sedation only. About once per year, 1 in about 500 patients do require full-on general anesthesia to do an open preperitoneal repair. And this is typically due to unique patient circumstances, so the anesthesiologist will talk to you about always potentially needing a backup for general anesthesia, though rare. You will then have someone from the team come by and typically use some clippers to clip the hair in the surgical area to reduce the risk of infection. It's important you wait and don't shave the area yourself because there's a risk of infection with cutting yourself shaving before surgery. Finally, you'll meet the surgical team. Again, you will have met them in the office. We will have explained the risks and benefits of hernia surgery to you in the office. And that day of surgery is merely to just say hello, make sure you're doing okay. Either the surgeon or physician assistant will go over a very brief high-level overview of post-operative recommendations that we have, including multimodal pain management to avoid opioids, instructions about activity, which we typically restrict for a couple of weeks, and bathing. That'll be all typed up for you, so you don't need to remember anything. But typically we tell patients to have some Tylenol and ibuprofen, or acetaminophen ibuprofen. Ibuprofen is Motrin. Some people use naproxen instead, but a combination of the two is very powerful. Having some ice at home available, or a frozen bag of peas or two, is also helpful to have, and I'll talk about that in future videos where that's used. And then there's really no special instructions for the wound that you'll get on that day. The surgeon will always mark the correct side or 2 or 3 locations where your hernias are. And then once all that's done, you'll meet, the last person you'll meet is the nurse from the actual operating room, who will help wheel you over to the operating room. At this point, you will get some of the first sedative medication and a dose of preoperative antibiotics to ensure your safety. We always give antibiotics prior to surgery when we implant mesh, especially for an open preperitoneal where the mesh is behind the abdominal wall. We want to protect you. That dose is fairly harmless. We have not seen side effects in terms of infections after, or side effects from an anesthetic, and it is really the standard of care. Next thing you'll remember is you're waking up in a recovery room. It's probably about a half hour after the surgery has taken place. A member of the anesthesia and surgical team will have potentially already seen you and checked you and already talked to you, but because of the amnestic quality of the sedative medication, you may or may not remember this happening. Once you're awake enough, you'll get a little bit of snack and drink. Make sure that you're safe to get up and walk around, and they'll get you dressed and get you home as quickly as possible. This could be in under an hour after the procedure in most patients. It could take a little bit longer depending on your own individual needs. If you are experiencing severe pain, pain that's really not tolerable to you, then we allow our nurses to give you a pain medication that's an opioid. Typically it's oxycodone. This happens in less than 1 in 20 patients that we take care of, but we don't want our patients to suffer. So if your pain is not tolerable, you will get a dose of an opioid before discharge, and we will probably send you home with a prescription. Again, that's probably less than 1 in 10 or 1 in 20 patients historically, and we know that less than 1 in 10 patients actually take any of the opioids we prescribe them. The drive home can be bumpy depending on how long you're traveling, so it's important to wear loose, comfortable clothing. It is critical to have someone travel with you from the surgical facility to home, accompany you to your house or apartment, wherever it is that you're living, or if it's in a hotel, if you've flown in for surgery. That first night, we strongly suggest and recommend that some family member or friend be with you in the slim chance that you need some additional support and so please arrange accordingly.